As lifelong Monroe County residents, it seemed inevitable that Tom and Jeanette Thompson would one day meet.
I met her while I was working at Jolly's Root Beer Stand. That's the corner of 15th and Walnut in Bloomington. I was, how old? 16 years old?
Yeah, you had a new car.
Right.
And the rest is history. They married and began a family. Both went to work with the Monroe County Community School Corporation. Tom as a teacher and later a principal, and Jeanette as a school secretary. Through the years, they worked hard to provide for their family and now enjoy retirement.
We have 5 grandkids, 2 that live in Denver and 3 that live in Noblesville. And they visit in the summertime. They come quite often, as they can stay.
Excellent kids. They really like coming down here. It's like camp where they can fish and ride the golf cart and do the things kids like to do. And we have time to do with them. And I'm outside anytime I can get outside. During the summer, I try to fish a couple of days a week with my friend Mike. Make garden, way too large. Give it away to church.
All of this began to change when joint pain started affecting both Jeanette and Tom at the same time.
I noticed mine when we were on a cruise. When we were on a cruise and we were going down, we were getting off of a bus to go into a land tour. And something, my knee gave out.
For Tom, the process was more gradual. Accomplishing everyday tasks wasn't as easy as it used to be.
It's hard to get on the tractor and mow when you can't get on the tractor. It's no fun to hoe in the garden when you can't get down on your hands and knees.
The couple met with their primary care physician and then chose Orthopedic Surgeon Dr. Jonathan Surdam at IU Health Southern Indiana Physicians to talk about joint replacement surgery.
I heard nothing but good things about Dr. Surdam. And I know he does it often. And I want somebody that does it every week. I don't want someone that does it twice a year. I want him doing that constantly because he's going to be able to, if a problem comes up, he's going to be able to handle it. And I kind of like the guy.
For Dr. Surdam, having 2 patients from the same family, both suffering from nearly debilitating joint pain at the same time, posed a unique set of challenges.
I think that in their unique situation where they both needed a joint replacement, it was important that we figure out who was going to help who. So the way we basically decided was that Tommy was very worried about Jeanette, and so we decided that she would be the one that would get her knee fixed first.
In February 2011, Tom and Jeanette arrived at IU Health Bloomington Hospital for Jeanette's knee replacement. Their first step toward getting back to the life they love.
They get you right up, get you walking, that day. And you think, oh my goodness, I don't think I can do this, but you're not in any pain. You still have so much, pain medication in you. So, but no, it was all very positive.
It's obvious by looking at me. Their food is even good. They have good food.
I think the thing that makes our program unique at Bloomington Hospital is the fact that the whole system is invested into patient success. We have a group of nurses that are dedicated to joint replacements and private rooms at the hospital, so you don't have to worry about what your neighbor's experiencing. And a team that has been doing this for a long time now that is very well versed on the care of and recovery of a total joint replacement patient.
As Jeanette recovered, Dr. Surdam and the couple planned for Tom's hip replacement surgery. In April, the Thompsons were back at IU Health Bloomington Hospital for Tom's turn at surgery.
They're good people, caring people. They know what they're doing. They'll take care of me and give it their best shot. And that's what I feel like I got. And that's all I ask that you do.
Today, the Thompsons have fully recovered and are enjoying their life together with their family, including their grandkids, and remembering to appreciate each and every improvement.
Aiden says, our 9-year-old grandson says, well, you're doing better, Nana. You can get up now. You couldn't even get down.
I can get in my boat, off of the dock. Rather than getting down on my hands and knees and then trying to get in the boat, I can actually stand up now and get back in the boat. So that's victory for me.
They were in tough shape before surgery, and I think we've been able to really help them as far as improving their quality of life, improving their pain, improving their function. So in general, I think it's two very nice success stories.
I'll probably have to have my other hip done, And his famous statement will be, "You will know when to come and see me, and if I have it done, I will go back and he will do it."
In the end, it all comes back to family for the Thompsons and creating a great life and experience for their children and grandkids.
Jeanette and I are not going to leave a legacy on this earth of some great magnitude. We're not great scholars and we're not great inventors and so forth and so on. We're going to leave a family. They were in the boat yesterday in the pond to catch a 3-pound fish, and it drags the boat around. He will remember that. Those are the kind of things that the kids will remember. That's the kind of legacy that we're going to leave on this earth.